Hello students, welcome back to Pharmaceutics 1, Unit 4, Pharmaceutical Incompatibilities. In this video, we will be discussing about the therapeutic incompatibilities. So in the previous lectures, we have seen the definition, classification in detail about physical incompatibility, chemical incompatibility. Now we are going to discuss about therapeutic incompatibilities. Okay, so this is the definition of incompatibility. What are therapeutic incompatibilities? Therapeutic incompatibilities are the incompatibilities which are arised due to wrong administration of the drug or error in the dosage forms. Okay, so what are the various types of therapeutic incompatibilities? Therapeutic incompatibilities may arise due to error in dosage forms. It may be due to error in the dosage form, wrong dose or dosage form, or by administering the contraindicated drugs, or by administering synergetic and antagonistic drugs, or because of any drug-drug interactions. So therapeutic incompatibilities, as I said, where there is an incompatibility when the drugs are administered in a wrong dose, or if there is an error, or if they are contraindicated but they are administered, thereby there is no action of the drug, or it may lead to synergetic or antagonistic activity of the drugs if those two drugs are administered, or because of drug-drug interactions. Now first one we will discuss error in dosage. Many of these therapeutic incompatibilities results with error because in writing or because of wrong interpretation of the prescription. So this is what is called as error in dosage. Many therapeutic incompatibilities results with error in writing or with wrong interpretation of the prescription. So what is the duty of the pharmacist? He has to check the prescription before dispensing the drug. For example, he has to dispense atropine sulfate, phenobarbital, aspirin, where it has to be prepared as a capsule. But if you see here, the quantity of the atropine sulfate supplied is high. So therefore, what is the solution? He has to refer back to the prescriber to correct the overdose. Now, the second therapeutic incompatibility is because of wrong drug or wrong dosage form. Now we know that certain drugs, they have similar names with small changes in their description or with the alphabetic, and therefore it is always dangerous of dispensing the wrong drug. So the drugs which are going to share with the similar names, always there is a chance of dispensing the wrong drug. So therefore the pharmacist should be very careful in dispensing such drugs. Example for the drugs like prednisone and prednisolone. The differences is only with LO. So therefore here the pharmacist should be very careful. In similar, if you take digoxin and digitoxin, so the differences in these two drugs is only with the TiO. So therefore the pharmacist should check the prescription properly. He should clearly understand what it is, whether it is digoxin or digitoxin, and then dispense the drugs accordingly. Now the third is because of contraindicated drug, administration of contraindicated drugs. Certain drugs are contraindicated, especially in certain diseases or to certain patients suffering with that particular conditions, diseased conditions. For example, corticosteroids, these are contraindicated in people having active peptic ulcers, corticosteroids. At the same time, if you see the drugs like penicillin and sulfa drugs, they are contraindicated for the people who have hypersensitivity reactions. In similar, drugs like barbiturates and morphine, they should not be given to asthmatic patients. So therefore, the pharmacist should check the prescription thoroughly and then see that whether they are indicated to that particular patient or not. And therefore, he need to check and thoroughly give those drugs. Example, sulfadiazine and sulfamerazine along with ammonium chloride. Ammonium chloride generally used as acidifier acidifier, and it may cause sulfonamide to deposit in the crystal form in the kidneys. So that means if a patient is suffering from any kidney conditions, so we know that if it is administered, it is all these sulfonamide drugs and these things will be deposited as crystals in the kidneys. Now, the other reason for therapeutic incompatibility is because of a synergistic action or an antagonistic action. So when two drugs are administered, sometimes the effect of the two will be higher than the individual drugs. This is what is called as synergism. Antagonism means when these two drugs are administered together, the effect of the two drugs is reduced than the sum of the individual drugs. For example, drugs like aspirin and paracetamol, they give synergistic activity. Drugs like penicillin and streptomycin, they show synergistic antibacterial activity. So certain drugs when prescribed may lead to disastrous consequences because of synergistic effect. So the prescription should be referred back to the prescriber for necessary action. The same thing in case of amphetamine sulfate and ephedrine sulfate. In similar, so we need to identify what are the drugs which has antagonistic effect and they should not be administered. And the last, drug interactions. The effect of one drug is altered prior or simultaneously with the administration of another drug. This is what is called as drug interactions. It can be corrected by proper adjustment of the dosage form if the suspected interaction is detected. Like for example, dispensing of acetophenetidine with acetyl salicylic acid and with caffeine. 3 drugs. This acetophenetidine, it mainly used as CNS depressant, whereas acetyl salicylic acid is an analgesic and caffeine is a CNS stimulant. So here what is happening, this is a type of incompatibility, but it is an intentional one, because since it is going to act as a depressant, we need a stimulant also. That is the reason they have been dispensed as such. But if you take the example of tetracycline, if it is written as take 1 capsule every 6 hours with milk, no, it cannot be taken with milk, because the tetracycline is inactivated with calcium salts of the milk. So therefore, the prescription should be referred back to the prescriber for the correction. So these are the various types of therapeutic incompatibilities. So what are therapeutic incompatibilities we have seen? What are the various factors for the therapeutic incompatibilities? And in detail we have seen all of them. Thank you.